When you think about vocal surgery, it's easy to assume the operation itself is the finish line. But what if it's actually just the starting block? Today, we're going to dive into why the real crucial work of getting your voice back begins long after you've left the operating room. It's a really common belief, right? You have a problem with your voice, a surgeon goes in and fixes it, and that's it, story over. So many of us see surgery as this one and done solution. But as it turns out, the research paints a totally different picture. So check this out. In a pretty big study of over 750 patients who had this kind of surgery, 5.2% of them still had major voice problems 2 whole months later. Now, that might not sound like a huge number, but that's about 1 in every 20 people. That's significant. And look, these aren't just people feeling like their voice isn't right. We're talking about real, physical complications from the healing process, things like stiff scar tissue forming or swelling that just refuses to go down. For them, the surgery really was just the beginning. So that leads us to a pretty big question, right? If surgery isn't always the magic bullet, what is? Well, the answer seems to lie in what happens after the operation, and the evidence for it is, it's pretty overwhelming. Okay, just look at this chart. The difference is, wow, it's stark. Time and time again, studies compare patients who get direct voice therapy after surgery to those who don't, and the results are just so clear. The folks in therapy see way bigger and more lasting improvements. It's not even close. In fact, if you want to put a number on it, one massive analysis, and I mean, they looked at 22 different studies, found something pretty amazing. Patients who got voice therapy after their surgery had a 14% higher rate of clinical improvement. In the world of medical research, a 14% bump is a huge deal. So the takeaway here is pretty clear. The research is basically screaming it at us. While surgery can get you part of the way there, you're giving yourself the absolute best shot at a strong, reliable voice when you pair it with therapy. Think of them as 2 essential parts of the same solution. All right, so we know it works, but the big question is, how? What is actually going on at a biological level that makes therapy so darn effective? Let's get into the science of it. The best way to think about it is like this. If you have a knee surgery, you don't just sit on the couch for months, right? No, you do specific, targeted exercises to get your strength and flexibility back. Voice therapy is the exact same idea. It's not about just kicking back and waiting. It's about actively, carefully guiding how that super delicate vocal tissue heals. See, your vocal cords heal in 3 distinct phases. First, there's inflammation. Then comes proliferation, where your body starts building new tissue. But that last stage, the remodeling phase, that's where therapy becomes absolutely crucial. It's what makes sure that new tissue becomes flexible and functional instead of stiff and scarred. And this, right here, is the secret sauce. The exercises in therapy provide something scientists call controlled mechanical stimulation. It's a fancy term, but all it really means is applying just the right amount of gentle stress to the healing tissue. This encourages your body to rebuild the vocal cord's delicate layers the right way. And this is why timing is everything. Get this. Research has actually shown that patients who start these gentle exercises after just 3 days of vocal rest have better long-term recovery than people who wait a whole week. Starting that controlled stimulation early really sets your healing on the right track. All right, so we've covered the science, but what does this actually look like when you go to therapy? Let's pull back the curtain on the modern therapy playbook. It's not as weird as you might think. Your therapist will probably have you do techniques called SOVTs. It stands for semi-occluded vocal tract exercises. This is stuff like humming, doing lip trills, that motorboat sound, or even phonating through a tiny straw. These exercises are just genius, really, because they let your vocal cords vibrate with almost no impact, creating the perfect, gentle environment for healing. And here's some really great news. You're not signing up for years of this. For a lot of people, a focused 6-week therapy program is all it takes to get to a near normal voice. And what's really interesting is that going for 12 weeks doesn't necessarily make things better. It just shows how powerful a short, concentrated program can be. But, and this is so important, it's not just about what you do in the therapist's office. The real goal is to learn how to manage your voice in your everyday life, building healthy habits that stick around long after you've stopped your official sessions. So all of this really points to a whole new way of thinking about this journey. It's not about a single event, it's a process, a mindset. And here's something that might really surprise you. The recovery process, it actually starts before you even go into the operating room. There's real evidence showing that patients who get counseling and education about the whole process beforehand actually have better results afterward. Just being prepared makes a measurable difference.
So when you put it all together, you see the most successful journey isn't just one stop. It's a whole path. It starts with education before the op, moves through the surgery itself, and continues into structured therapy and rehab. Every single step is vital to the final outcome.
So let's just boil it down to this. Surgery and therapy have two totally different but equally important jobs. The surgery's job is to remove the physical problem, the polyp, the nodule, whatever it is. Therapy's job is to teach your voice how to heal correctly and work efficiently so that problem never comes back. So at the end of the day, the path to your best possible voice isn't something that just happens to you. It's something you have to actively participate in. Understanding this whole process empowers you to take the wheel and become a true partner in your own recovery.